Hello, how are you? My name is Sydney and I will be the nurse taking care of you today. Can I have your name and date of birth, please? Okay, your name is John Doe and your date of birth is 9/24/1965. Can I just take a look at your wristband? Okay, thank you. I was made aware that you received a new diagnosis of HIV. How are you feeling about that today? Yes, that's completely understandable to feel overwhelmed and anxious. Hopefully, I can help relieve some of that anxiety today. Can you tell me what is stressing you out the most right now? Right, you are going to be started on a lot of new medications to treat your new diagnosis. May I provide some information about the different medication options? Let's start with the pathology of your diagnosis. HIV is a viral infection that is transmitted through bodily fluids such as blood, semen, and vaginal secretions. The virus is very fragile and needs a host to survive. It will attach to certain cells in your body called T lymphocytes. The T lymphocytes are part of your immune system and they're composed of white blood cells. Once the virus begins to attach to these cells, it slowly destroys the T lymphocytes and multiplies itself so that the viral load of HIV rises in your body. This is dangerous because by destroying the T lymphocytes, your immune system is compromised. The objective of HIV medications is to decrease the viral load of HIV and save your immune system. Unfortunately, these medications do not cure HIV, but prevent it from increasing and progressing to AIDS. There are several categories of medications that do this that are called antiretrovirals. The first class is called fusion or entry inhibitors. This medication works by preventing HIV from attaching to the T cells. This medication is administered subcutaneously or under the skin. It is not the first choice for HIV medications, but is used when other antiretrovirals are not effective. The generic name of this medication is enfervitide. Some side effects to look out for with this medication are bacterial pneumonia or a systemic allergic or hypersensitivity reaction. Another class of antiretrovirals are called CCR5 antagonists. These medications work similarly to fusion entry inhibitors by preventing HIV from binding to the CD4 T lymphocyte. The CCR5 is part of the cell membrane of the T lymphocyte, and the medication stops HIV from entering this part of the cell membrane. A common name of this medication is Maroviroc. Side effects include liver toxicity and pseudomembranous colitis. Do you have any questions so far? Yes, that's a good question. What happens if this medication becomes toxic for my liver? In that case, you would discuss medication alternatives for this medication or a possible adjustment to a lower dose with your doctor. Another class of HIV medication is called NRTIs. These medications reduce HIV by preventing the DNA of the virus from replication. These medications are usually the first choice to treat HIV in the short term and are given orally. Side effects include suppressed bone marrow, fatty liver, and nausea, vomiting, and diarrhea. Common names of these medications are abacavir, lamivudine, tenofovir, and zidovudine. A final category of antiretrovirals are called NNRTs. These medications work similar to NRTIs by stopping viral replication, but their method of action is on reverse transcriptase. This medication is often a first-line choice and used in combination with other HIV medications. Complications include rash, flu-like symptoms, nausea, diarrhea, and insomnia. Common names are nevirapine, etravirine, and rilpivirine. I know this is a lot of information, so I'm going to include some educational pamphlets that go over these medications. Your doctor will further discuss which medications you are prescribed. It is very important that you take these medications every day to prevent HIV from replicating. Do you have any further questions? That is a good question. Can you spread HIV while on antiretrovirals? Yes, it is still possible to spread HIV while on antiretrovirals. The medications work by decreasing the viral load on your body, but it does not eliminate it. You should still use safe sex practices like using condoms to prevent transmission. Do you feel like you understand what medication you might take and how it works? Great. If you have any other questions, feel free to ask me.